How to lower an overly high female hairline. Relatively important concern of women that they have a hairline that doesn't look too high. High hairlines generally can connote senescence. It also can create somewhat of a masculine appearance. Basically, there's two procedures. One is hair grafting, and the other one is what's called the hairline lowering surgery, forehead reduction surgery, also called the surgical hairline advancement. Let's talk first about hair grafting. Hair transplantation or hair grafting is a very common procedure. It's performed by probably thousands of doctors throughout the world. And basically involves, it's the same essence of any standard hair transplants, where we're taking hairs from the back of the head and then putting into areas where there's thinning, into tiny recipient sites. Typically the hairs are placed 1, 2, or 3 at a time. If it's done aesthetically, it can really create a natural look. It's a typical procedure to lower hairline. Can be anywhere from 600-700 to as many as 2,600 grafts, which is basically 1,200 to as many as 5,000 hairs. That's typically done in a single sitting. Procedure takes probably anywhere from around 4 to as much as 8 or 9 hours, depending on how much work is being done. Hair grafting is basically the most common procedure performed for lowering hairlines. In general, the hair grafting procedure is better for women who are seeking more rounding out rather than actual lowering, although it can lower the hairline. Also women that have tight scalps and/or women that have had prior facelift or brow lift where there may not be good blood supply to the scalp that would allow the other procedure, which is the surgical hairline advancement. Surgical hairline advancement is a procedure that's not performed by a lot of surgeons. It's a very specialized procedure, something I've been doing now for over 20 years. And basically, it's a really cool procedure because what it essentially does is it lowers the overly high hairline by as much as 2, even 3 centimeters, over an inch, all depending on how much laxity or how much mobility there is of the scalp. If a woman's got a very loose scalp, I can lower the hairline more. It's a single stage lowering procedure. It's pretty dramatic in its ability to basically immediately lower an overly high hairline by, as I described, as much as an inch or more. The procedure is basically intended for women, number one, that have a loose scalp, but also women that are seeking the most rapid results. The way the procedure is done, it's around a 90-minute procedure. It's done in usually under twilight or IV sedation anesthesia. An incision is made along the hairline, and then the modification that I make is I round out the very corner and then I go back. That allows me, as I lower the hairline, to have some rounding out. So essentially the incision with the patient asleep is made. The scalp is basically freed up, brought forward, and then secured using these special surgical clips that will dissolve by themselves over the first 6 months. But during that time period, it keeps the scalp in its more anterior direction. The excess forehead skin is then excised. The incision is closed, leaving a very fine line scar, which is designed so that hairs grow through it. It's called a trichophytic incision. So the hairline scar is essentially, in the majority of patients, is minimally, if at all, visible. However, we do sometimes do some grafting after the hairline advancement, as soon as 4 months later, to do a little bit of filling in. For the appropriate candidate for hairline lowering surgery, the results are unsurpassed. I get quite a few referrals from hair transplant surgeons from around the country that recognize that their patients will be better treated with the hairline lowering surgery, mainly because the improved density that we can achieve, because essentially one hairline lowering surgery is the equivalent of transplanting over 6,000 grafts. So there are two options: hairline lowering surgery, also called the surgical hairline advancement or forehead reduction surgery, as opposed to hair grafting. Two procedures, both with their indications, both wonderful procedures when they're performed properly on the appropriate patient.